Today I'm going to give some perennial injections. So I'm going to first need to check my MAR and my physician's orders. So I would look on the MAR to see what medications I need to be given, and then I would check my physician's orders to make sure that there is an order for all these medications and that they've been transcribed correctly. I would check for the patient's name, make sure the name is correct, and the patient number. So I would gather my supplies, making sure that I have checked all the orders and that I check the medication and making sure that I have the medication, the correct medication. I would check that 3 times. So I would gather my supplies. I have my syringe, my needle, and my medication here. So I would wash my hands and put gloves on. I would then pop off the seal that has made it sterile. I would take my alcohol swab and clean off the top of the vial. I would then check and see how much medication I'm going to be given. So I'm going to be giving 0.5. So I would draw up 0.5 milliliters of air. And then I would inject 0.5 milliliters of air, making sure I inject air into air. I would then invert the medication, drawing it to just above what I need, making sure to tap out any air bubbles and waste up to the correct amount of medication that I need. So you never pick up a cap and recap a needle. You have to use the spike method. So you would sweep your needle onto your cap and then secure it. Now for intradermal injections, I would use a 25 gauge needle, and I would inject that at 10 to 15 degrees with a 5/8 to 3/4 inch needle and 25 gauge, and using an intradermal needle or syringe. For sub-Q, I would use a 25 gauge needle, 5/8 inch, and I could inject those in either the upper shoulders, the lower back, the abdomen, avoiding the umbilicus, 2 inches, and I can also give them in the outer aspect of the arm. For IM injections, I would use a 23 gauge needle, and I can give IM injections in the deltoid, 1 milliliter, and the ventrogluteal, 3 milliliters, and the vastus lateralis, 3 milliliters. Now I will show you how to give a intradermal injection. I would clean the site using a circular motion for 30 seconds. After I have put on gloves and washed my hands. So I would let that air dry and I would make sure that the bevel is up 15 degrees, and I would inject it in and inject the medication, making sure it made a wheel. I would then close the security cap, and I would make sure my supplies went into the correct location. Any syringes or needles need to go into the sharps container. For a sub-Q, like I said, you can use it in the abdomen, making sure you avoid the umbilicus. You can use the outer aspect of the arm or the upper shoulders or the lower back. For the IM injection, I would go find the chromium process, the 3 finger breaths below the chromium process, and I would inject it right here. And now if we can go in here, I will show you the ventricle here and the, okay, so for the ventral gluteal, I would find the greater trochanter. I would position my fingers toward the iliac spine, and I would spread these 2 fingers right here, and I would inject right there. Now the vastus lateralis, I would find my landmark by putting my hand over the knee and above the thigh, and I would inject right there. I would then dispose of my needles in the proper place in the sharps container, and I would remove my gloves and wash my hands.